The United States isn't the only one announcing more funding for global vaccines.
La proposition de doubler la contribution.
The European Union's Executive Commission says it plans to double its contribution to the World Health Organization's COVAX program. They are pledging over $1 billion to deliver vaccines to poor nations. Another $121 million will support vaccination campaigns in Africa. Meanwhile, here in the U.S., some of the states with the smallest populations are having the greatest success when it comes to COVID-19 vaccine distribution. According to data from the Centers for Disease Control and Prevention, New Mexico, North Dakota, and West Virginia top the list, ranked by the percentage of COVID-19 vaccines they have administered of those that have been distributed to them. Dr. Mark Strand, professor at the North Dakota State University School of Pharmacy and Department of Public Health, joins me now on Skype. Dr. Strand, so good to see you again. We just mentioned the top states with the highest distribution rates, yours being one of them. Why do you think North Dakota has been so successful in its vaccine rollout, and what's made the difference there?
First off, last summer, we were one of 4 states that were selected by the CDC to do a early preparedness planning scheme. And so we were ready to deliver and administer the vaccines as soon as they were made available. We've also had tremendous cooperation among pharmacy, local hospital systems, clinics, and of course, the public health department. So that's another reason for our success.
And what do you think other states can learn from your state?
Certainly central coordination with cooperation. You can't have health systems, trying to monopolize access to doses. And so just that sense of equity across the state under coordinated leadership is really key.
I know, Dr. Strand, earlier this week, the COVID-19 variant first detected in the UK was identified there in North Dakota. What do we know about those cases?
Yeah, this week we've had our first cases of this new variant. And, I do want people to know that this is not a surprise. These viruses, they mutate frequently and usually they become dead ends. But then sometimes they do persist in the population, and that's what we're experiencing. And I hope that people realize, first off, there's good evidence that the vaccines we currently have are effective against those variants. But it's also a reminder of why we need both a high vaccine coverage, and then also we need to continue to use our common public health preventive measures that we've been doing in order to really snuff out the cases that are out there. It's also a reminder that there's always a risk that these variants could represent a kind of seasonal coronavirus that we could have to cope with, indefinitely, for example, having annual vaccinations. So, yeah, it's of concern, but nobody should feel any need for panic over this.
Yeah, that's good to hear for sure. Well, across the U.S., there's still a lot of conversation about whether it's safe or not to return to the classroom. Can you give us your perspective on that as both a public health expert and also an educator?
Yeah. Public schools have not been the source of a lot of outbreaks. They know how to follow rules. And although it's, young people who have low levels of risk, as long as the teachers and the administration are clear in enforcing guidelines such as phasing in return to school, of course, mask wearing, and then using pod mechanisms of group learning. There are ways in which we can return to the classroom safely. And let's hope that this can happen, because it's really important for the young people's just mental health and just their social needs.
Absolutely. We need to get our young people back in school for sure. Well, Dr. Strand, thank you so much for coming on. We always appreciate your analysis.
Thank you.